This has been a beautiful day. My name's Jason, if you don't already know that, and I'm here to talk a little bit about the patient experience. Check 1, 2, there we go. So my introduction to the cannabis industry was through being a patient as well. About 10 years ago I had an injury, a lot of soft tissue damage, a lot of pain maintenance for the rest of my life, and the only answer that modern medicine had for me was opiates. Recently buried a friend to an opiate-related death, and really just didn't feel comfortable with that commitment for the next decades of my life popping pills. And was lucky enough to be in the Colorado area at the time, and had a naturopath that led me in a different direction. The cannabis industry in Colorado was just starting in the early 2000s, and met some great local dispensary owners and educated them and kind of built their brand and my patient and plant experience together in that environment, and I've been blessed to be in it in some way or form ever since. So I truly believe I am a patient's advocate first. I believe this industry only exists because of us as patients, and thus those of us that respect and appreciate the plant for what it has to offer. And I love hearing the different experiences and draws to this industry. So we've got a panel of some amazing people. Everybody's going to share their own individual story. Basically want to give them the respect to have their time to tell the story, and then open the floor up to anybody who has any patient-related or experience questions. So again, thank you very much. I'm going to introduce Mike Deals, closest to me. I'm going to introduce Mike and hand him the microphone, and thank you.
For those who don't know, my name is Michael Deal. I'm a patient and a dispensary technician. So a little bit of background about me. I was a young 25-year-old, his life just right before I asked my wife now to marry me, and things were looking good for me until I started having seizures just out of the blue. My diagnosis was complex partial seizures with second to rare generalized seizures. Thank you, Billy. And for this reason, I didn't really know what to expect. I didn't know I was never really with pharmaceutical drugs. That wasn't like what I was into. I wanted to stay away from that aspect. But I thought, I don't really have any other choice. I started on Keppra and then on Tegretol. Made me a completely different person. Thank God, my fiance stayed with me, and now we're married and everything's good. But for a long time, it was very hard. It was particularly hard because being a union carpenter, building the high rises, you can't have epilepsy or any form of the seizure condition and still do your job safely. So what I started to experience was kind of a falling out with my newfounded career, and it really kind of took a toll on me from the stress and the anxiety, the depression. I was laid off for 1.5 years. I was using marijuana for recreation beforehand. I was uneducated. I was misinformed, just like most of the people that I come in contact with. I started to educate myself, realized that maybe I could start using marijuana to treat my conditions. Almost instantly, I started on a 20-to-1 Charlotte's Web, which was a medical marijuana product. It was a product based out of hemp. It was really, really good for a while. When my first appointment last February started, I started taking some products in there, and almost instantly I was able to come off my drugs. I no longer take Keppra, I no longer take Tegretol, thank you. And it was actually nice enough that the first dispensary I went to, Jason was, running things over there, and he realized my love for the plant and for how well it started to work for me. So he said, hey, would you like a job? And he didn't know what that meant to me, and for me and my family, it was everything. being laid off for a year and a half, this helped me with not only my seizure condition, but stress, depression, things at home, pretty much an overall better life experience. I came in contact with people I never thought I'd come in contact with. I've helped patients along the way. It's incredibly rewarding. There's nothing I would ever do to go elsewhere to get the benefit that I'm getting. You know, I'm a better person, I'm a better mentor and an advocate now for being part of the program as much as that I'm involved in. And really, it's been everything for me and my family. So that's pretty much it, that's my story. I'm just gonna open up to questions. Questions? No questions? Next story, cool, next story. Thank you, everybody.
Hi everyone, my name is Michelle. I'm here on behalf of my son. He's the little guy in the back. He's 2 years old. He is a medical cannabis patient, and he started having seizures when he was 2 years old. I'm sorry, 2 months old. The doctors had put him on anti-epileptic medications, benzos, trileptal, Keppra, Vimpat, Onfi, Zonisamide. Valium, a lot of drugs that he became addicted to.
It's okay. It's okay.
We were slowly losing our son. He was slipping away. He had stopped sleeping. He had stopped rolling. He had stopped laughing. He had stopped smiling. It was pretty bad. He was overdosed on medication that's not FDA approved for children. We wanted to try CBD, just CBD first, and our doctors told us that he couldn't. We had to go through, 4 different anti-epileptic drugs before we could even consider hemp-derived CBD. We were uneducated. We didn't know at that point that it was legal and we could have used it. So then last year we had learned that it became legal in Pennsylvania. We had applied for the medical marijuana program, and he was approved. He started Cannabis last April. Thank you. We actually, when we were weaning him from the medication, he experienced really bad withdrawal. To watch your son, your baby withdraw from benzos was torture. It took us over 10 months to get him off of just 2 milliliters of Onfi. And the doctors didn't want anything to do with it. They basically left it up to us to deal with all of the withdrawal symptoms. He would have status epileptic. He would go into seizures where rescue meds wouldn't bring him out. His oxygen would drop as low as 4. And the only thing that brought him out fast enough was cannabis, RSO, where we would have to give him a rectal Valium and he would still be seizing for over 20 minutes. And his oxygen would just continue to drop, but cannabis brings him out of a seizure, a deadly seizure, within a minute or 2. He's completely off of all seizure medication. Today is a huge day for us. Today is the longest day that we have gone seizure-free, and we are at 23 days. He was having over 70 seizures a week, and when he was on the medication, he was having multiple seizures a day. I could show you pictures before and after where he was so drugged, he wouldn't even look at you. Like, his eyes would be all over the place. He was losing weight, he wasn't eating. It's crazy because within 12 hours of us coming down in just the one medication, what they had told us was reflux, but it was just a side effect of the medication. The vomiting had gone away. Within 24 hours of being completely off, he started rolling again. They don't tell you that these medications are going to be addicted and that your child is going to become dependent on them, and that it's going to be impossible to take them off. So that was pretty much our journey with him. He's doing well, he's getting stronger. They had mentioned earlier about hospitals not being supportive of it, and we learned the hard way. Last December, we had taken him into a hospital, not in this state, a hospital that has let us use his cannabis there before, and we took him into the emergency room because he had pain in his leg. We didn't take him in for seizures. And they called Delaware State Police on us. They had called Child Protective Services on us. They had opened up claims against me for medical neglect and child abuse because I wanted to use the only thing that saves my son's life. So, we do need to end the stigma. That's why we're here today, to speak for our son, to speak for other parents who, are afraid to, use cannabis for their children, because it does. It saved my son's life. If he wasn't on cannabis, I can't say that he would be here today.
Hi, my name's Barb, and I've been a recreational smoker since I was 16. And I went to college, I have a master's plus third degree, and I've had a GPA of 3.9 my whole life, and I was the top 3% in math across the United States on a professional skills test, so it doesn't mess up with your neurons. So in 2011, I was playing softball in a co-ed league, and I was running the first base, and we were going to the playoffs, and the guy playing first was blocking the base path with his leg, and I hit it between second and third out into left field, and the guy was throwing it in, and I ran, and I had to jump over the guy's leg, and when I came down, my husband was coaching first base. He gave me a high five. I went down, and from my knee down, bent completely upward. So I shredded my ACL, my MCL, my LCL, so they ended up putting cadaver parts in it, and then a couple years later, I needed a shoulder surgery because I had arthritis in it. Then this one hurt, and they got in there, and I had a hole in the head of the humerus, and it was bleeding. They had to grind it down. And my dad, I thought I was in a golf cart accident. I hit my head, hit my back on the seat, fell out the cart, and I was out for like 5 seconds. But I got a brain injury from that. So in the front left lobe of my brain, there's a little white spot. So I still have both doors, and whatever, I just have delayed cognition, so I'm lucky there. But about a year, then my doctor started giving me the Xanax and the oxycodone, and I was up to 90 milligrams a day of the oxy and 4 milligrams of Xanax every day. So it's like I started losing my mind, and I went and I said, I went cold turkey, and I got off of everything, and it was the most horrible experiences of my life. Like you said, it's like you sweat, you feel sick, and I went into medical marijuana, which is really a great thing. The only complaint I have is that you really have to open up your wallet, and I think if they pass House Bill 50, it'll make it easier for Michelle to make the RSO for her son. And for people like me, my mother with the Alzheimer's, who I can just see within like 5 minutes, same as with a seizure with the Alzheimer's patient, they go from being scared and thinking people are going to kill them to laughing and having a joyful time and being able to color within the lines, being able to use different color markers. Cognition, there's like lucidness there where there wasn't any before. So I really find it as it changed my life. I mean, as recreational, I always liked it, but medically, I always had a fear that if I went off the oxy, am I always going to be in pain? And I started having pain back in October. I started feeling sick, and I fell and hit my head. I had the seizures from the Xanax and stuff last summer, but went off that. And then I hit my head again, and I had to take a taxi to the doctor, and here I had Lyme disease. So they gave me all these rounds of stuff for Lyme disease, and then my knee was still hurting, and my neck hurts. So I went to the doctor, and I went to Rothman this time because the Premier Orthopedics, they're not like primary marijuana, at least I know Jefferson doctors work at Rothman, and they do the medical marijuana research studies, so they're really more affiliated, they know a lot more about it than a regular doctor. And I need a knee joint replacement with new space on my left knee, and also in my neck, I have 2 neck discs that are compressed, and I have to get a Demerol procedure, but to me, the marijuana was so potent that I didn't know until I got to this point that I'm going to need this, or like this Demerol injection, or I'm going to need a knee joint replacement. I mean, my knee brace is on a 3. I mean, when I was walking without the knee brace, my leg was actually slipping and everything. And with my mother-in-law, she broke her hip about 8 weeks ago. She was up walking within a week from the CBD, and the RSO I have has 8% CBD, it has 77% THC. It also has the CBG for the brain and the neurons. So I really like that stuff, but one thing I pray is that the price goes down or they legalize it for us to grow. Thank you.
Hello, my name is David Nuno. I am 62 years old, and for most of my life, I've been a functioning alcoholic. I am Julie's father, if anybody wants to know. That's how I'm here. For most of my life, I've been a functioning alcoholic. And about 5 months ago, I got a medical marijuana card, but I got it for PTSD. I have problems sleeping at night, so since I got the medical marijuana card, I have cut my sleeping medicine in half, and I have not had a drop of alcohol in 5 months. I think that marijuana is a great substitute for alcohol, and for alcohol harm reduction, I don't see another product better than that. And I just think that it should be advocated for alcoholism too. And that's my story. Thank you.
Hi, my name is Dina Honesty, and I have multiple sclerosis. I was diagnosed about 19 years ago. If you're not familiar with MS, it's a disease, it's an autoimmune disease. It's very, very unpredictable. And when I was initially diagnosed, I wasn't able to walk. I just, over the course of a few months, lost the function in my legs. And that was my introduction to the world of MS. And then 3 months later, I could walk again, which was kind of cool, but also very scary, because you don't know what you'll wake up to. So I've had it for 19 years. I think I've been very fortunate with the course of the disease. I have a lot of invisible symptoms, not visible to other people. I can't feel my hands. I have a gait disorder. I've had some cognitive issues, but the average person would have no idea. For much of that time, I was so grateful that I didn't have the nerve pain that so many people with MS suffer with. And I felt like I could face anything it could bring. And then about 6 years ago, I woke up one morning and I hurt from the top of my head to the tips of my toes and everywhere in between. I called my neurologist and we talked about some options. She prescribed some conventional medications, nerve blockers, as well as some other medications. None of them could touch my pain. I just was living in pain. The next step would have been to go up to an opioid or a narcotic pain medication. I felt like that wasn't an option for me. I'm a parent, I have 2 kids. My husband travels a lot for his job. I could not be incapacitated to that point. So I said, well, I guess this is my new normal. And I was living with the pain. It was definitely challenging, but I'm lucky to have a great support system around me, so I did have a lot of help with my kids. I had an appointment with my doctor. I was seeing her every 6 months, and we were trying to figure out options. She said to me, probably about 5 years ago, it's really unfortunate that marijuana is not legally available here in Pennsylvania. That would really help you. So I felt that she was trying to not quite so directly tell me, you need to get a hold of some marijuana. So at the age of I don't know, 38, or not even 38, 43. I wasn't really sure where that source would be. It had been about 20 years since I had recreationally used marijuana. So I kind of made it work. I had a friend with cancer, and she had marijuana, so she was giving me marijuana for a while. Then I had a friend in Colorado, and she was sending me marijuana. It was great. I mean, it's fantastic. It immediately takes the pain away. And my only qualm with it was that, well, I can't do this during the day because I need to be able to jump in my car and get my kid if she's sick at school. So I felt like, I had the solution, but it wasn't ideal. And it wasn't legal. And, as a parent, you have to weigh what kind of risks you're willing to take. So that's kind of how I went along for the last few years. And I'm fortunate to be a family friend of Skip Shuda's, and I knew of his involvement and his lobbying to get medical marijuana legalized here in Pennsylvania, and things moved along, and I was so grateful when that finally happened. I feel like I have to thank the parents of these children with seizure disorders, because if it was not for their lobbying, I do not think medical marijuana would be available here in Pennsylvania for all of us who can benefit from it. So we really need to take it. Thank you very, very much for being so persistent on behalf of your son and on behalf of all of us who benefit. So it's been great. I'm so pleased that I kind of felt like I could come out of the closet and, be open with how I was managing my pain and talk to other people who had other conditions who could benefit and say, this is something you need to look at. It's been a big learning curve. There are a lot of questions from people. How do you know how much to take? How do you know? There's so many choices. How do you know which strain? How do you know what form? And what I tell people is it's just like conventional medicine. How do you know how much Tylenol to take? Trial and error. It's the same thing with medical marijuana. Trial and error. But it's a pretty safe thing to go through that process with. I'm still learning. I feel like I have so much to learn, and I'm so grateful for the people in the dispensaries that I have met who have so much knowledge and have taught me so much about different ways I can address my MS pain. And probably one of the most significant is that I now have options of things that I can take during the day and be fully functional. So it's been huge. And I think for anyone who would hesitate to encourage a family member to look into medical marijuana, I'm here to tell you, I'm married to the most straight edge guy on the planet. And the reason I hadn't used marijuana for so long was because when we got married, he said, no more of that. So he has done a complete 360. And if he can change his view, I think there's a hope that anyone's view can be changed. And I think that we need to really encourage people to recognize it for what it is. It's medicine. If anyone would want to talk to me about my experiences, what's worked for me, what hasn't, please feel free to approach me. I'll be happy to talk to you.
So I'd like to take about 10 or 15 minutes and open up the floor to anybody who has any questions for anybody up on the panel here. Ryan's got a microphone for you.
Hi, so I see a lot of patients in the dispensary with MS. Would you ever be interested in sharing your experience with other MS patients?
100%, absolutely.
I think it would really help some people.
I do. I mean, I think there's a lot of hesitation to approach marijuana as a medication, but I think anyone with an autoimmune disease knows that each person's course of their disease is so unique. And there are a lot of medications out there for autoimmune diseases that have a lot of side effects. And I definitely would be thrilled. I would love to spread the word, and I would love to share my experiences, for sure.
Anybody else have questions? Okay, great.
Big mouth, I probably don't need a microphone.
No, they don't know you're
I have a pretty big mouth. So we've been doing this medically, not me, my husband, for 7 years in New Jersey. And one of the issues we had was how to address it with our son 7 years ago and how to make him understand. So what have your experiences been like explaining, you know, the delicateness of kind of what's happening in the home with it?
My daughter is 9. She's back there. She, you know, we just educated her. You know, I had to talk to her teacher at school because she knows that, you know, medical marijuana saves her brother's life, and you know, when they learn about, you know, drugs in school, that's one of the things that they learn about. And her teacher was great with it. The school knows about it. We haven't come across that yet to where there was an issue with her talking about it, but she knows that it's a medicine. She knows that anything can be abused. You know, she can take too much chamomile and get sleepy. You know, alcohol is legal, cigarettes are legal. You know, too much of anything can cause somebody to be not normal, so we just provide her with education, and we're very open in the house because, I mean, a seizure can come at any time, and she needs to know that, you know, if I'm putting it in his mouth, she can't touch it, like she can't wipe his face or anything like that because it could absorb into her skin. So, you know, we just provide her with a lot of education, and it's been a year and everything's been good. She knows that it saves her brother's life, and hopefully eventually she wants to learn how to make his medicine herself. So yeah, so that's pretty much how we handle it at home. We haven't had any issues at all with school or anything like that, so it's been pretty good for us.
So I struggled with that. I know earlier I had said that it brought generations together, and that was part of what I was speaking of. My daughter is now 21 years old, but you know, I have been a cannabis patient for a couple of years now, maybe not legally, but so that was a very confusing time in our house because it was still illegal, and she was a child, and so it was my point was always just you know, you're a child. When you make an adult, you can make adult choices. But, you know, of course, there's pediatric patients, so that's also something that we had to talk about in a different way. So it's just a lot about having the conversations and being as open as you can about it, I believe. So now that it's legal, it certainly has sealed that gap. So thank you. Does anyone, we do have another question back here.
Hey, so I want to preface this first just by saying I think that the rhetoric of cannabis as a medical substance and as a medicine is really important, especially right now with the kind of ridiculous, you know, walls that we face just due to kind of bureaucracy, the slow-moving face of politics. Having the medicinal front of cannabis, I think, is, you know, a very important thing. And I'm curious, this is almost more of an observation maybe, but I'm curious on to like some level or at any point, do we acknowledge that we like to get high? Like, and I don't ask that and like, oh, why don't we talk? Like, I'm just curious in terms of, I don't know, just in terms of talking about it and being honest, because I think that's kind of, you know, the route that things need to go to be integrated into our society healthfully. I like, of course, and I say again, I think it's an important thing to push the medical side of it, and at what point do we acknowledge the recreational side of it? in this atmosphere is really my question, I suppose.
Well, that's a great question. You know, a lot of people have this question. Really, for me, it's about feeling. If I feel better, you know, and that's the psychoactivity, the high that you speak about. If that high makes me feel better, especially from a mood standpoint, like stress, anxiety, depression, yeah, I like the high, you know, but that's not what I'm doing, and that's not what I'm seeking out. If you having a conversation with your doctor, and that conversation goes about, well, what strain do you like? And you would then say, well, I like this for my pain, and I like this for the effects or for the mood I get from it. Generally, trying to educate people and bring this about in a normalcy kind of aspect, you kind of want to stay away from, it's more terms. Saying I like this psychoactivity sounds a lot better than saying I like to get high, right? So that's what we try to educate on for, you know, from a dispensary standpoint, as far as verbiage, you know, how you say it is really that's the most important. But it's a great question, because a lot of people, you know, that I come in contact with, they have that question. Well, this don't really help with my back pain, but I really like the way it makes me feel. Well then, you know what, buddy? Well then you keep getting that, and then here I'll get you something else for your back pain. Okay?
Yeah, thanks for clarifying. I really just kind of wanted to bring that into the discussion.
Yeah, awesome.
I also think, to add to, I think what you said is absolutely 100%. The terminology is huge. And, but I think to address that aspect, for me, personally, my husband comes home from work every day and has a couple of beers. And I wouldn't consider him an alcoholic. I don't know how mood altering it is, but it certainly is relaxing. Well, I don't like to drink. So if I want to relax, I will get my medicine out and use that to relax. And I don't see a problem with it, but I think it's all about opening the dialogue. And I think it is really important, the words you use, and I think it's a much easier dialogue to open if it's opened as a medical discussion, and then you kind of bridge it over to that discussion of recreational use. But I think the point about our current political environment, it's just not widely acceptable to frame it as a recreational thing right now. It is becoming more, I think almost every day, it's more acceptable.
I don't have a question. I kind of want to address this point.
Yeah.
I've been a medical patient for over 10 years now. And, you know, I've had people say things to me like, you just want to get high, or, you know, things of that nature. Well, if that's what I wanted, the opiates the doctor was giving me were doing an awesome job. Right? But over the past 10 years, I've changed the way that I speak about it. I say cannabis. I say medicine. I don't say, hey, let's go get lit, you know. But I do feel sometimes that people are definitely looking at it in that respect. But I live in New Jersey. I've had a medical card for about 7 years now. And I've gone to, you know, town meetings and other places in New Jersey, and, you know, the people running the meetings, you know, say things to patients like, how much of your medicine did you smoke and did you drive here? Like, while we're trying to advocate. So we definitely need to change the way we talk about this.
Hi, my name is Susan. I have a question for all of you patients. You say that, do you have to reset your dosing? And do you ever take a complete break? And how's that working for you?
I can speak for my son. We did have to reset, I think, for him, you know, especially coming down in the benzos. He was building up a tolerance to THC. So something that was really, really like a high dose for him, I would have been like on the floor for days. Because he was having a lot of seizures, so we were using it a lot. But when he was in the hospital in December, they wouldn't allow us to use it, and they had put him back on their medications. And so we took that as a positive thing. When we got out, we gave his body a chance to reboot. So instead of giving him a high THC as he was on before, we started with just like hemp-dried CBD oil, and we used that for a month, and that was the first time he actually went 23 days seizure-free. But then he started having leg pain, which I think is neuropathy. So we did slowly introduce back, a little bit, like a low dose of THC. So I do believe a reboot is good for, I can't speak for everybody else, but for my son, that's what we needed to do. And Mike was great with helping us dose for rebooting.
I would just like to add just a little bit. That's a fantastic question. I get that question 100 times a day. I really kind of every 3 to 6 weeks might have a different product. Something I would definitely caution you to do is once you figure out what works with you, have that conversation with your doctor and your dispensary technician and the pharmacist and the medical professionals, because there are multiple products out there with similar terpene profiles that can give you similar reliefs. And if you can focus down on that, you can really figure out what's working for you and why. So for me, if I don't go at least 2 days every 3 to 6 weeks without THC or CBD, then my tolerance is actually elevated. So I would encourage patients to look into microdosing and figuring out how that works, and definitely be open to trying new things. The one product that works for you, we want to make sure you have that. But hey, maybe try picking up this lower cost product that has similar possible benefits. That way, you don't run into problems that you see most patients run to where you're out of that one product that you need and you can't seem to get the relief. Do the trial and error right in the beginning, and then that way you have 3 or 4 different things to switch up your dosings like you're talking about.
On a much less technical level, I can address that from a purely patient standpoint. So when I was using medical marijuana from Colorado, it was a premium for me. I didn't want to ask my friend overstep asking her, so I would really divvy it out and save it for when I really was in a bad way as far as my pain was. Once it became legal here and the dispensaries were open and they had a product, I found a few things that worked well for me and used them regularly. And I did find that I felt that my tolerance was getting higher, and I needed to use more to get the same relief. And I didn't want that. I as a parent, I don't want to be stoned all the time. I need to be there and present, but I still want to get that relief. And so to what Mike said, what I learned is there's so many products available, and I feel like every time I go to a dispensary there are more products available. It can be really overwhelming to the average lay person like myself. So you tend to stick with those 3 things that worked for you. And I would encourage you have to use the technicians and the people at the dispensaries. They have so much knowledge. And I think I did get into a rut for a little bit where I was just buying the same thing and I was using more and more. And I realized I needed to learn more about what was out there, and I went to the dispensary that I prefer to go to, and I learned a lot of new things. And I think every single time I go to the dispensary, I learn something new. And what I did recently was I have been exploring strains that have a higher CBD concentration, and I was nervous, will this work as well for me? And I'm finding it does work well. I still get the pain relief. Would I go to that higher CBD product every single time? No, but depending on the situation, that's what I've been doing. And I feel like there's always new things to learn, and you just have to be willing to try new things and branch out. And I have purchased some things that didn't really work that great for me, and that's okay because I learned from that. So I would definitely encourage you. It is very overwhelming, the variety of strains and products available, but I would just encourage you to use the resources you have, which are the people in the dispensaries, and I think that the physicians are getting more knowledgeable. But for me, my experts are the employees of the dispensaries. I've found that they've helped me more than anyone else.
I'm Jason Mitchell.
You are now an expert.
Yeah.
That's crazy.
And that's the rewarding part, is for her to understand that she is now your resource. Thank you all. We're going to take a couple of minutes. The senator's going to come up and talk to you. We've got the very exciting industry panel coming in about 5 minutes.